The biggest fork in the road is to understand, is it acute or a chronic thing? So if it's an acute like an acute stress, acute trauma, acute inflammation, acute infection, there's a lot that hyperbaric therapy can do for almost anybody, alongside conventional therapy, doing it in conjunction with other therapies and treatments. If it's a more of a chronic issue, so something you've had for a longer period of time, say you've had chronic Lyme, or you have mild cognitive impairment, chronic pain, it's very likely that hyperbaric therapy is not the first thing that you want to do. And the adage that I always say here is, it's not if hyperbaric therapy will be helpful, it's when. And I think the when is like the most important part of the whole strategy that I use when I work with people.
We were talking about our connection to Baltimore and how you became so interested in hyperbaric oxygen therapies. This is something that I think is on most functional integrative medicine providers' radars now, but you've actually been using this technology for actually quite a long time. What got you initially interested in it as a therapy for your patients?
So yeah, the Baltimore connection was kind of an interesting one, right? Because you know about this place called Shock Trauma in Baltimore. So Baltimore is known for its shock and its trauma. And there was a show back on HBO, when it was called HBO, called The Wire.
It was a fantastic show.
Fantastic show, was filmed in Baltimore. And in fact, there was a burnt out, decrepit, old, large building that was in the second season that I lived in after they refurbished it as part of like this, reorienting or refurbishing project in the area called Fort McHenry in Baltimore, where I lived for about 2.5 years at the end of my time there. So, but in medical school, lots of shock and trauma. We did a rotation at the Shock Trauma Center, which is basically an ER and a surgery center combined, is the best way to think about it. And downstairs in the basement, there is a huge hyperbaric chamber. And they were using it for things like burns, but a lot of the burns went to Hopkins, but things like flesh-eating bacteria, which is also called necrotizing fasciitis, severe wounds, severe trauma. And I was very tired, Cynthia. Like we were on, so the way shock trauma worked at the time for a medical student like me was that you were on call, what was called Q3. So every third night, you were on call for 30 hours. And so then you'd stay obviously the whole day and the night and half of the next day. You'd sleep for about 4 hours. You'd get up and have dinner, maybe, if you were awake enough. And then you go back to bed, and then you wake up and you do it 2 days in a row, regular days, get there at 7, leave at 5 or something like that. And then that third day, you'd again go for 30 hours. And then you maybe get like 1 day off a week. And it was for 3 weeks. So I was like dazed and confused a lot of the time that I was in in shock trauma. But I just remember this one patient that came in with neck fash or necrotizing fasciitis, flesh-eating bacteria. It's like really nasty. There used to be like these articles in the paper when we were back in the 90s and 2000s, like just people like their flesh and like getting eaten off, and like it's nasty. But hyperbaric therapy has this amazing capacity to stop that infection in its tracks and reverse or mitigate a lot of the damage. And so I saw somebody specifically that looked like they were going to have to get all 4 limbs amputated, which is not uncommon with this particular infection. They didn't need to get 2 of their limbs amputated. They just needed to get 2, but not 2 of the others. I think it was both feet were amputated, but both arms were actually intact. And so I was like, where did they go? What just happened? Because like basically for me as a student, I saw them come in the trauma bay. I saw them leave. I saw them come back to the trauma bay, like a different human kind of thing. And so I got really interested in what that was. And then when I had more time and I got a little bit more sleep, I looked into hyperbaric technology and I realized the power of this. And this is back in 2005, I think, when I first learned about it. And so, and very interestingly, at the same time, or just about the same time, my father, who's a chiropractor on Long Island, is Dr. Alan Sherr, who's been a chiropractor now for 45 years and counting, he was getting very interested in it from a alternative perspective, looking at it for people with kids with autistic spectrum on the spectrum, for example, and seeing really amazing benefits. And so, my dad was my first mentor, and he was a chiropractor, and as I mentioned, still is. And so we would talk all the time about my experiences in medical school, and they just felt there might be some connection here where I could bring this sort of chasm of alternative and conventional world together inside of the world of hyperbaric medicine.
Yeah, it's so interesting because it is something that probably has been on my radar the last few years, but even though I was a ER trauma nurse in inner
Yeah.
city Baltimore. I actually did not actually work at University of Maryland. So although I did rotations at University of Maryland, I did not physically work there. It's a really, for anyone that is in the Baltimore milieu, like Hopkins has the level 1 trauma center for peds. All the adults, generally speaking, go to shock trauma. It's a phenomenal place. I can't
Yeah.
imagine being, that kind of rigor of being a student and then, going 2 days, fairly normal days, and then 30 hours. You just were chronically sleep deprived in perpetuity. I can just imagine.
Yeah, I mean, in medical school, I'm not sure about in your professional schools, but like for in medical school, we had these shirts made that said "Sleep is for quitters," and I think the absolute opposite now. Of course, we have much more tolerance when you're in your 20s to be able to be more resilient to these things, and that's why they can bludgeon us with these kinds of things. Although, as you know, Cynthia, the work hours and the amount of time overall that medical students are spending in the hospital is much less compared to even when I was in medical school now, almost was a while ago, over 20 years ago now. And so things are getting better. We know that everybody works better when they're not sleep deprived. And
Yes.
so it was a big piece of this whole puzzle. But they'd always say, "Oh no, you have to stay up late because that's when you see all the crazy stuff that happens at 3 o'clock in the morning." And they're not wrong, but you can just stay up since midnight, not since 7 o'clock in the morning, and you could still get that anyway. So things have changed, but definitely sleeplessness was the name of the game those years. And I feel very differently about sleep now. That's for sure.
No,
So,
I think we both do. And was on a rotation of like days and nights. And so I
oh,
felt,
oh, that's terrible.
I described to
Yeah,
people that I felt like I was never fully awake because I was so chronically, habitually sleep deprived. And now we know
it's the
better, but
worst. Yeah,
my heart goes out to people that are still working those kinds of swing shifts because it's not easy to do.
yeah.
Let's talk about how does HBOT work
Mhm.
and what you are using HBOT for now versus where you
Mm,
were 10 years ago.
mm. So yeah, my practice to take out the second one and give like a little bit of tease of it before we get there to the definitions is that my practice is a truly integrative one where I mostly focus on the things that are not covered by medical insurance. And we'll talk about there's 14 indications that are currently covered in the United States. In some countries, it could be as few as 5. In other countries, it can be as many as 70 or 80. So Japan, China, and Russia have the most, and some of the Queen's countries, your UK countries, Canada, Australia have the fewest, interestingly enough. And so my practice is an integrative one where I integrate lots of tools, technologies, practices, labs, ancient practices, new cutting edge technologies, all things together inside of a hyperbaric ecosystem that includes hyperbaric therapy, but doesn't always actually include hyperbaric therapy. And you and I have had podcasts where we've talked about other things, and
Yeah.
that'll all kind of integrate as we chat later. That being said, let's go back to your first question, which is what is hyperbaric oxygen therapy? So, hyperbaric oxygen therapy is the definition is pretty simple. It's just the combination of increased inspired oxygen plus increased atmospheric pressure. That is it. And so let's go through those because people need to understand what oxygen and pressure are, right? So, oxygen, it's pretty straightforward. Most of us know that we need to have oxygen to breathe or to make energy. Why do we need oxygen? Because it's what's called the final electron acceptor in your mitochondria. So you need oxygen to be an electron sink, basically, to take all these free electrons out of the electron transport chain and allow you to make ATP or our energy currency. So, fun fact, we make about 165 pounds of ATP, our energy currency, every single day. So that's a huge amount of energy that we need overall. And so the mitochondria are the engine that do that. Okay. And so in normal conditions, at sea level, at most people that are listening will be, there's about 21% oxygen in the air that you're breathing. So the rest of it's mostly nitrogen. If you live in a city or in a polluted location next to farms and industrial crops and things like that, you're going to have other pollutants and things like that. But that 21% of oxygen does a really good job at saturating a type of cell in our body called the red blood cell. Red blood cells are the cell in our body that carries all the oxygen from our lungs to the rest of our body to create that energy currency. Okay. And so red blood cells have something on them called hemoglobin. Hemoglobin is a molecule that binds oxygen, and every hemoglobin molecule can bind 4 oxygen molecules. And so Another fun fact, because I have a lot of these, there's 250 million hemoglobin molecules per red blood cell. So every red blood cell is carrying just about 1 billion oxygen molecules. Pretty
It's
cool, right?
incredible.
Yeah. And so it's amazing this is happening. Like none of us were aware of this, of course, right? So everybody's put on a pulse oximeter on their finger at this point in their life. Pulse oximeter is what they're measuring is how many sites on those red blood cells are saturated with oxygen. So if you have normal lungs, your oxygen saturation is typically going to be somewhere between 97 and 100%. So, and that's the amount of sites on those red blood cells that are carrying oxygen. So the question becomes, how can you get more oxygen into the system? That's already being well infused with oxygen. Those red blood cells are already pretty well infused with oxygen, even at 21% oxygen in the air. So you can do this a couple different ways. The most common ways is to increase the amount of red blood cells you have in circulation. The number of red blood cells goes up, the more of your oxygen carrying capacity is going to go up. And so, how do you do that? You can come visit me here in Colorado, where I live. At Colorado, we have about 16% oxygen in the air at 5,500 feet or so. And what we do living in Colorado is that you make more red blood cells. You secrete a hormone called epigen, or EPO for short. That epigen hormone is increasing the number of red blood cells in circulation. So this is why you always hear this adage from athletes: train high, and then compete low, right? Or something like that, right? But training high, that's why there's tons of athletes that live in Colorado and states like Utah and Wyoming, because they train at these altitudes and they come back to sea level and they feel and they have much more oxygen carrying capacity because they have a number of red blood cells that's higher compared to the average. Now, you can also take this hormone as an exogenous injection, and this is what doping is. Okay. Mm-hmm. So there's another way to increase your oxygen carrying capacity that doesn't, it's not relegated to your red blood cells, but actually to the plasma or the liquid of your bloodstream. So the liquid of your bloodstream is what carries everything else. It carries your red blood cells, it carries your nutrients, it carries white blood cells, it carries everything, right? It's like kind of like water, but more like a saline kind of solution. And so in a hyperbaric chamber, we can drive oxygen not only on those red blood cells, but actually into the liquid of your bloodstream. And we do that using pressure. So this is the other aspect of it. So pressure. So we increase the amount of atmospheric pressure you feel under a certain amount of seawater. So if you're 15 or 20 feet below the sea and you look up at all that water, you don't feel like that water is heavy. But if you picked up a bucket of water, that water would be extremely heavy. And that heaviness is what is pressure. And so we simulate that heaviness in the chamber up to a certain degree. It can be like a mild amount of pressure, like 15 or 20 feet, or it could be a deeper 33 feet, 45 feet, 66 feet. We have a couple of these different metrics that are correlated to various types of things that we call ATA, or atmosphere as absolute. So like 1.5 ATA is about 20 feet of seawater. 2 atmospheres of 2 ATA is 33 feet of seawater, and 3 atmospheres is 66 feet of seawater. So we simulate that pressure in a hyperbaric environment. You don't feel like you're underwater, but you do feel like that pressurization sensation that you would feel. Now, the combination of that increased inspired oxygen with that increased atmospheric pressure drives a potentially huge amount of oxygen, not only if there's any other sites on that red blood cell left on the red blood cells, but also into the liquid of the bloodstream itself, which could be up to 1,200% more oxygen in the liquid of your bloodstream. So that's the power of hyperbaric therapy, is that you have this acute infusion of a huge super physiologic level of oxygen. And then from there, I'll stop for a moment, and you can ask questions, but from there, it's the power of all that oxygen, both acutely, so immediately what happens when you're in the hyperbaric chamber, and then long-term doing a hyperbaric protocol, what is the shift that happens in your expression of various genes and things related to what's called your epigenetics, related to all that oxygen coming in.
That is the best explanation I've ever heard of HBOT. And this is why, listeners, for them to understand, this is why I wanted you to have this conversation with me. Talk to us about how HBOT can be utilized to potentiate longevity. I think there's a lot of discussions around longevity,
Sure.
and cellular senescence, and how can this be beneficial specifically for that indication?
Cool. And this is not the first rodeo of me explaining it. I've figured this out over many years,
You perfected it.
Cynthia. Yeah, I've gotten the structure of it over the years. But the next piece that I think is important to discuss longevity is to discuss what's actually happening when you're in the chamber. Okay. And so we talked about all this oxygen coming in. So there's basically only three things that are happening when you get all that oxygen in circulation. The first is that you're reversing low oxygen conditions. So if you have an acute low oxygen state, like let's call it a stroke, a heart attack, a traumatic brain injury, a spinal cord injury, a limb that's hanging off sideways, these are, and you remember these kinds of things from trauma. Yeah, but this is an event where some of the body is not getting enough oxygen. So if you can get somebody inside of a hyperbaric chamber quickly, you can potentially mitigate the damage downstream of that lack of oxygen. So we've seen studies in all the things that I just mentioned where hyperbaric therapy can be transformative if you can get them into a chamber as soon as possible, with, of course, doing your other conventional indications. So that's the first thing that's happening. We're reversing low oxygen conditions. The second thing we're doing is we're creating what's called oxidative stress. And when you're creating oxidative stress, that means you're creating a stimulus in the body for things to change. And oxidative stress is not always a bad thing. People think of this as a bad thing because they hear it as a bad thing, but our body is always responding to stress. And the hope is that it's called eustress, right? This is good stress. Yep. But it can also be distress. And this is where it becomes really important long term. And I'll get there in a minute. The third thing that's really happening in a chamber is that there's pressure induced changes. So the pressure itself creates blood flow. It creates lymphatic flow. It probably creates more of something called easy water, which is a kind of a structured water around blood vessels as well. And so that and that pressure itself is causing more energy to be produced. And so as a result of those three things happening, the acute things that are happening once you get into a chamber. So you're reversing low oxygen conditions, you're making more energy, you're decreasing inflammation and swelling, you're increasing the number of stem cells that are being released from the bone marrow and other areas. And stem cells are the baby cells in our body that help us understand, like help us regenerate tissue anywhere it might go. It's also an anti-infective, and that's why it worked in shock trauma with neck fash, for example. It's also an immune system booster, and it also increases blood flow and lymphatic flow that I mentioned. So that's all happening immediately, okay? So long term, what happens long term is that those epigenetic changes are happening. Epigenetics is the study or the science of how our DNA shifts expression. Genes turn on and off, about 8,000 oxygen-sensitive genes, in a way that helps with growth, repair, decreasing inflammation. So you get new blood vessels, for example, so angiogenesis. You get downregulation of inflammatory markers, things like interleukins and TNF alpha and things like that. You get those stem cells that fully mature into the areas that they are going to help recover, regenerate, decrease inflammation, whatever it is. So as I'm talking about all of these things, longevity should be thinking about longevity in all of these ways, okay? Because what is longevity, what is health span really as it is trying to optimize our lifespan and our health span at the same time. So if our brains deteriorate as we get older and we regenerate them, that's longevity, right? And health span too. If our cardiac muscle starts not working as well and regenerate cardiac function, that's longevity as well. So there was some studies done in the early, like 2020, 2021 on longevity, looking at how hyperbaric therapy decreases senescent cell populations. These are called zombie cells that accumulate as we get older. It increases telomere length, which is telomeres of the ends of your chromosomes that get shorter as we get older. And there's also signs of reversing the deterioration of blood vessels in the heart, like regrowth there, regrowth in the heart, regrowth in the genital area, so better erections for men. This works in women too, by the way, at least clinically, I'll tell you that much. But also, it's just a overall strategy where you're decreasing inflammation, you're rebuilding blood vessels, and you're optimizing physiology and healing wounds from the inside out, really. And it is really what is aging, but wounds, as it were, and inflammation related to those as we get older.
What are some clear-cut contraindications? If someone's listening and they're like, I think this sounds awesome, I want to run out and do some therapies. What are some clear-cut contraindications? People that should be, whether it's temporarily or kind of long-term, this would not be a treatment for them to utilize.
Sure. So there's what are called absolute and relative contraindications. Absolute are the things that you absolutely would not go into a chamber ever. And then there's relative, which is a much longer list, actually, of course. There's only one indication that's an absolute contraindication, and that's called a tension pneumothorax. And a tension pneumothorax is when the lungs are filled with air, not the lung itself, but the cavity, and pressing your lung down, you can't breathe. And if you have one of those, you should be in a hospital. Okay.
Mm-hmm.
And so, but you are putting pressure on people's lungs to go into hyperbaric chamber because that's how the pressurization gets gets translated into the extra oxygens in circulation. So there's a lot of what are called relative contraindications. And I have a much longer list than the average, actually. But relative contraindications, if you have any severe pulmonary disease, cardiac disease, if you have a seizure disorder, like a neurologic disorder, that's not controlled because increased oxygen can cause seizures. It's very, very rare, but we have ways to mitigate that. If you're pregnant, you're not supposed to go into a chamber, but they do use it for carbon monoxide poisoning, and it's very, very effective for that. But it's not technically what you're supposed to do. If you have a fever, you're not supposed to go into a chamber. If you have really difficult time clearing your ears because it's a pressurization change. And there's others, but the main things, if you have like severe like or end stage disease from like a primary organ, then you have to be thinking about it. But for me, Cynthia, the biggest fork in the road is to understand, is it acute or a chronic thing? So if it's an acute like an acute stress, acute trauma, acute inflammation, acute infection, there's a lot that hyperbaric therapy can do for almost anybody alongside conventional therapy, doing it in conjunction with other therapies and treatments. If it's a more of a chronic issue, so something you've had for a longer period of time, say you've had chronic Lyme or you have mild cognitive impairment, chronic pain, it's very likely that hyperbaric therapy is not the first thing that you want to do. And fun story, I was disinvited to a hyperbaric conference because the title of my talk was going to be, please do not put them in the chamber. Not good for business. But I worked as a medical director of a number of facilities before when I was in California, before living in Colorado. And I did have to, this is difficult. I didn't own the facilities. Like I wasn't there, running the facility and trying to make money from people going into the chambers. But there's always a balancing act here, right?
Mm-hmm.
I don't know if you remember this, maybe because I think you were training around the same time as me. There was a great YouTube at the time. YouTube had just come out a couple years earlier than that, but it was on basically if you have a heart and you go to a cardiologist, you're going to get an EKG and an echo. If you have lungs and you go to a pulmonologist, you're going to get a chest X-ray and PFTs done, right? These are just standard. So like if you go to a hyperbaric clinic, they're going to try to put you in the chamber, right? It's the same kind of deal. So the key fork in there is an acute issue or chronic issue. And then if it's a chronic issue, how can we create an integrative opportunity for you to truly leverage everything that could be helpful for you, not just a hyperbaric chamber, but what are the dietary changes, the lifestyle changes? What are the labs and supplementation that you can take? What are the other ways we could potentially downregulate your nervous system so that you can heal, right? And then we spoke about GABA a lot, another podcast just about this. And so when it comes to contraindications, to go back to your question, most of them are relative. And what I find is that the ones that are not the more serious relative ones, but the ones that are more on the chronic condition side of things, if you can work with somebody, which I typically do for 3 to 6 months prior to them going into a hyperbaric chamber, you're not really wasting any time because they've had a chronic issue. It's not like this started a month ago. This started years often. And now it's about building them back up from the foundation. And the secret to all of this, Cynthia, is that if I do my job, hyperbaric therapy may not even be necessary, because you're able to get them to a place where, oh, I just changed my diet. I stopped drinking alcohol and I downregulated my nervous system and I feel 95% better. And then I'm like, well, you can still do hyperbaric therapy, but maybe we'll do it another time, that kind of thing, as opposed to doing it now. And the adage that I always say here is it's not if hyperbaric therapy will be helpful, it's when. And I think the when is like the most important part of the whole strategy that I use when I work with people.
Well, and I think it's that medical decision making that is so important, and that's really what you're speaking to. And I think for a lot of patients, HBOT is a really amazing tool, but ultimately it's a tool. It's one of many tools, and we still the lifestyle piece still has to be addressed. And you have brought this up in previous conversations, but when I'm looking at my patient population, women in perimenopause and menopause, how many of them are high functioning workaholics. And when I
Yeah,
say this, you don't have to be working outside the home to be a high functioning workaholic. It's a trauma response. It's, your perfectionism that's drawn inward. You're in this chronic sympathetic overload, overactivation. And so when you're thinking about that particular population of patients, which you're shaking your head, so I know you know what I'm talking
of
about,
course. Yes.
how are you so obviously if it's an acute thing and they're appropriate for HBOT, that's great. But for a
Yep.
lot of these other patients, it might be lifestyle changes that could have just as much of an impact as going the route of HBOT.
Yeah, 100%. I mean, the way I think about the acute side of things is I call it my educationally throwing shit at the wall strategy, where I have a framework that I use, and as long as they're safe to go into a chamber, they've been, for example, if they've had a concussion, they've been cleared and they're okay. Like then I have a whole battery of tools, technologies, labs, supplementation, and things that I can do to help you downregulate their nervous system, increase nutritional optimization as best I can short term. But if it's somebody in the case that you're describing here, I have another good example. So this is a fun one for me, kind of. I When I gave myself a concussion maybe 4 or 5 years ago, it wasn't a very spectacular one. This is when I had young kids and I was in the bathroom and somebody yelled and I like went like this to a side wall and I nailed my head, right? And so good news, I have hyperbaric chambers at my disposal. So this is more of an acute issue, but it's going to dovetail into, I promise in a minute, what we're talking about. So I went to my local facility that I was a medical director in the Bay Area and I went in the chamber. And in some chambers, and like in these particular chambers, you can watch movies. And so this
Mhm.
particular chamber had a TV screen outside of it, and you can listen to it. And I decided it would be a really good idea to watch John Wick 2 in it. And if anybody's listening and they know John Wick is like a ridiculous, like it's just really violent, lots
Very
of death
violent.
and
Yep.
destruction. And I was in there going like this and shaking. I'm like, this is not going to help me heal, you know? And, and so it dovetails to what you described there, which was, if we're really trying to prepare somebody, like there are a lot of great ways that hyperbaric therapy can accelerate healing, recovery, anything from, so many different kinds of ideas and things that we can talk about here. What's coming to mind right now is like a surgery, right? Hyperbaric therapy is fantastic pre-post surgery. This is more of an acute issue, of course, where you have like a surgical indication. But if you're trying to prepare somebody for a hyperbaric program that could be very, very beneficial for them, it's going to be much more beneficial for them if you can work on downregulating their nervous system and trying to work on optimizing the machinery in their system to make energy. Hyperbaric therapy, as I mentioned earlier, is all predicated on getting all this oxygen in circulation, allowing you to make more energy as a result of that. And also, when you make all this reactive oxygen species, these oxidative molecules, that's what oxygen does to a significant degree when you're bringing a whole lot in there. The body has to respond what's called an antioxidant neutrality, an antioxidant response. And so if you're antioxidant deficient, if you don't have optimized levels of the machinery to help you make energy or the optimized levels of the machinery to help you to neutralize the waste products in quotes of making energy. So we make ATP, we also make carbon dioxide, water, and these reactive oxygen species. And so in my practice, I figured this out very early on that when people were too sick and I tried to get them in a hyperbaric chamber, they would just get sicker. And sometimes like a little bit of that stress is fine. And we're used to that because the body recovers over about 3 to 4 days. People that are relatively optimized or doing okay. But if you're not, like you could be down for a week or longer. And I was trying to figure out what was going on. And I went back to the physiology and I realized it was like, oh, it's what we call redox. It's all because we're bringing all this energy in to be made. Can they make energy effectively? And they're bringing all this, oxidative load in the system too. Can they detox or can they neutralize that? So for me, when I'm talking to somebody, when they call me and they say, "Hey, Dr. Scott, I want hyperbaric therapy for fill in the blank," then I'm doing an assessment there of the acuity, number one, and the second is, well, is it the right time for them to go in, or can we do some things, and work on their physiology and sympathetic drive is a big one because that sympathetic dominance, that cortisol dominance, is going to deplete your GABA levels, which we talked about in a previous podcast. GABA is your neurotransmitter that calms down the firing of your brain and it relaxes you. It's your off switch, basically. And so if you don't have enough GABA around, you're going to be more anxious, you're going to be more stressed, you're not going to be able to sleep, you might be depressed, and you might be thinking that's just your baseline, and it could be, but it's kind of a vicious cycle on some level where you're just depleting over time. And so one of the goals I have is to work on downregulating the nervous system so that people can actually heal, because you can't heal in a hyperbaric chamber like I was shaking when I was trying to heal from my concussion. It's not going to work. If you can downregulate the nervous system, you're going to be able to heal better. But this is important too. It's not just about downregulating the nervous system oftentimes, because as you know, people are trying to compensate for something. They're trying to compensate for mitochondrial dysfunction, for hormone dysregulation, for brain inflammation, right? And so as a result of that, you can't just work on it like, oh, we just need to calm you down. That's all you need. Just calm you down, right? Like that's not going to be enough, because what's going to happen is that you calm them down and then they feel worse because their system needs a lot of support. So for me, it's usually a multifaceted strategy where nervous system downregulation at the same time as energy and machinery for producing energy and detoxing being optimized. And there's multiple levels of that. Like there's obviously the mitochondria itself, where we're talking about. There's also macronutrients, so like optimizing your ability to actually process those. There's your gut, there's your neurotransmitters, there's your hormones, there's your relationships, there's, it goes out and out and out. There's your environment. So there's all these other levels that we can go at. And I think for every person, you have to start at a different angle there. But in essence, what I'm trying to do is, mitochondria are kind of the final, or the most common denominator for all of those other levels.
Well, and I think it really speaks to the art and science of medicine that, you could have 10 people with similar presentations and they might all need different strategies to
Yep.
start with and to end with. And that's why I sometimes get frustrated. And I have to believe it's well meaning individuals because I refuse to think about it any other way. But I'll sometimes see
Nice of you.
across social media like this one size fits all band aid approach to middle aged women. And I'm like, if it were just about hormones, everyone would be fine. If it
Yep.
were just about hormones, if it was just slaps an estrogen patch on every postmenopausal woman, I wish it were that easy, but it
Of
really
course.
isn't. And it's really that bio-individual approach. So let's think about this from the perspective of middle-aged woman. Let's say she's working diligently on balancing her autonomic nervous system. She's still dealing with some anxiety and sleep issues
Sure.
and brain fog. And, when you're looking at how best to support this woman from a very holistic perspective, very integrative approach,
Mhm.
what are some of the low level things that are relatively easy and accessible for everyone that you think are foundational to addressing brain health, neurocognitive health at this stage of life?
It's a great question, and there's so many ways to think about it. Um, there's like the dietary, there's lifestyle there, but let's assume here that people, like as you mentioned, are trying to dial in some of this already. They're already working with you, or they already know your work, and they're on that, let's call it the transformation, right? Like
Yeah.
they're already working on that aspect of things. And so what I would say is that the focus oftentimes needs to be on cellular medicine, the idea of working on the mitochondria itself. Now, if you're already working on the diet, the lifestyle, the behaviors, like that's great. Like those are really, those will, for lack of a better term right now, trickle down to improving mitochondrial function. So if you really make it a point of getting to sleep every night at the same time and waking up every day, like that's going to really be a benefit to your mitochondria over time. So there's kind of like a top down and bottom up approach here is what I would say. But my approach oftentimes in people that are already starting to dial in a lot of the lifestyle things is the bottom up approach, which is, well, how can we optimize your mitochondria to make everything else easier? And so there's a couple different things that I use as sort of really easy, low hanging fruit levers at this point. One of them happens to be, and I think maybe we talked about another podcast, methylene blue, and
Mm.
and methylene blue is a fantastic one because it's a compound, it's a synthetic ingredient. It's been around a long time, and it is synthetic, so people get worried about that, but it's very safe if you find it from the right sources. And not everything synthetic is bad for you. Not everything natural is good for you. Cynthia and I have probably seen people. So in shock trauma, well, actually not in shock trauma, in the ICU at Maryland, University of Maryland, I saw a couple of people die of foraging for the wrong mushrooms.
Yep.
And yeah, probably seen a couple of those
Very
over the
sad. Very
yeah,
sad.
it's not a fun death at
No.
all. And so not everything natural is good for you, just to be clear about that. But methylene blue is this compound that's been around for a long time. It's got a lot of press over the last 6 months or so, but I've been using it much longer than that for the last 5 years or so in clinical practice. And what I find about it, which is super interesting, is that you can give very low doses of this, 4 milligrams, 8 milligrams, 16, maybe a little higher, but maybe sometimes even a little lower. And that's going to do something very specific in the mitochondria, which is increase energy production and increase detoxification. Energy and resilience is what I tell my patients. But the problem is that most of us, 94% of US adults, are walking around with mitochondrial dysfunction. And our mitochondria are the ones that are part of our cells that make energy. And if we can't make energy well, what does this manifest as? It depends on where the mitochondria are most affected, but maybe most women maybe not know this, but we have the most mitochondria in our cell, if you're a woman, in the ovaries, in the eggs
Yep.
themselves. And then in men, it's in sperm. And then by the next is your brain, your heart, your liver, excuse me, and your musculoskeletal tissue. So brain fog, concentration problems, cardiac issues, detox issues, exercise-induced fatigue, infertility, these all at their sort of root or at their bottom level is a mitochondrial issue. And so why are some people having these issues? And Cynthia, you and I know the reasons, but number one reason actually is insulin resistance.
Mhm.
And so people that are diabetics, pre-diabetics, insulin resistant, medications that we're taking on a regular basis, things like PPIs and metformin, these destroy parts of the mitochondria itself or make them dysfunctional. Toxins in our environment, which are everywhere, including toxic people. That's also, yeah,
Yes.
don't
Why
forget
boundaries
that.
are so important.
Yeah, exactly. Infections. And then after infections, your post infectious syndromes like your long COVIDs, your fibromyalgias, your chronic EBV loads, and things like that. These are all people that have chronic mitochondrial dysfunction. And so, what methylene blue can do, and I use it a lot in my hyperbaric protocols actually, is I use a very low dose of it before they go into the chamber so that they have increased capacity to use that oxygen effectively to make energy. And they have enough detoxification reserve so that extra oxygen coming in is not causing too much stress on the system. And so, low hanging fruit for me is mitochondrial optimization in general, or the bottom up approach, I would say. And so I use a lot of methylene blue, and then at the same time, I'm also working on their sympathetic nervous system from a mitochondrial perspective, because what happens there is that if your cortisol is elevated for too long, your blood sugar is going to be more elevated as well, giving you this it can look like insulin resistance, even in people that have normal insulin levels. And I was just talking to another menopause expert recently. She was telling me about, the type of perimenopausal women that has, elevated A1C, but actually it's not because they're pre-diabetic, it's because their cortisol is elevated all the time and their blood sugar is elevated, but you look at their insulin levels and they're normal, right?
Yep.
And so I didn't know about this. It was very interesting to me. But I'm sure you talk about this all the time. But when that cortisol level is elevated all the time, it's putting a lot of stress on the mitochondria. And so if you can, what I've been doing is working a lot on the GABAergic neurotransmitter system at the same time. So, and this has a multifaceted aspects. We talked about this last podcast, I think, but like this is looking at their gut, for example, and how is their gut leaky or not? Looking at neurotransmitter levels of things like glutamate, which is an excitatory neurotransmitter, and looking at the balance between that and GABA, and then using supplementation to help work on the GABA system while they're doing the diet and lifestyle and things like that too. But I have multiple different angles there that I work. But of course, hydration is a big one too. Most women and men are not hydrating well enough. And so like getting hydration is really, really important. Fun fact, it's better to sip throughout the day rather than to gulp and then not drink for long periods of time, unless you're doing lots of exercise. I need to get fancy electrolyte solutions. I know there's a lot of them out there, which I use too for the convenience, but just a little bit of, a pinch of salt in water can go a long way. If you want to add a little bit of honey to it, you can do that if you're more active, or even if you're not more active and need a little bit of a, what's it called, a downregulation of your nervous system. Because one thing that I know you're big into the fasting as well, but we have to be careful because, fasting can also release more stress hormones in
Yep.
people too. And so when you're and I'm sure you can probably add color to this part, but from a fasting perspective, carbohydrates can be good, and some women are not getting enough, and men are not getting enough carbohydrates to actually calm down their nervous system as well. So I tend to have that conversation too.
Yeah, no. So there's so many insights that you just provided. So number one, methylene blue, you definitely brought on my radar after our last
Yeah.
conversation. I think there's a lot of, again, I have to believe it's well-meaning people that talk about methylene blue, but I see people not consuming small quantities. I see
Right.
people consuming copious quantities. What are some of the untoward effects that can happen if someone, like, it's all about this hormetic, this role of hormesis, beneficial stress, right amount, right time. But if people are overdoing it with methylene
Right.
blue, what are some of the things that you look for or cause you concern as a clinician?
So the key to understand methylene blue is that at low levels, it should not cause a hormetic stress on the system. We're trying to just support the system. So there are certain things that we want to be hormetic stresses, and hyperbaric therapy is one of those, especially at deeper pressures. And I can delineate that a little bit because there's different pressures that we use, different types of chambers, things like that. But overall, low doses of methylene blue are not, we're not trying to cause a stress on the system. We're trying to compensate for dysfunction, usually, or compensate for a lower oxygen environment, because what methylene blue can do is it can act just like oxygen in the mitochondria to help you continue to make energy, even if there's not as much oxygen around. So if you come visit me in Colorado, hopefully before you get on the plane, but definitely when you get off the plane, I'm giving you methylene blue while you're here because it does seem to compensate for that low oxygen state. And then we're also working with endurance athletes, at least informally, although I have a couple things in the pipeline that I'm excited about, where we've seen their endurance go up, their aerobic training capacity go up as a result of being on methylene blue while they're doing endurance work. The problem, and this is kind of what you were alluding to, is that higher doses of methylene blue, especially over about a milligram per kilogram, which is going to be about 70 milligrams or so on average, can cause stress on the system as well. Even lower doses can do it for some people. So you have to be careful. But the higher the dose, the more stress the system is going to have. Some of that stress is related to something called, excuse me, the production of hydrogen peroxide. So hydrogen peroxide is something that our cells make to help kill bugs and to biofilms. It kills biofilms too, and it recycles cells if you don't need the cells anymore. So hydrogen peroxide is a great anti-infective. And so using higher doses of methylene blue around those doses can be very effective. However, if you're making more hydrogen peroxide in the system, the body has to compensate for that by creating more antioxidants to help neutralize that. And that's the primary one is glutathione in this case.
Mm.
And so you have people that can't tolerate those higher doses because they don't have enough antioxidant capacity. So in the patients that I do, I need to give higher doses that are sicker for whatever reason, I'm giving them more antioxidant support, while they're on the higher doses. But once you get to above about 2 or 3 milligrams per kilogram of methylene blue, which is about 150 to 300 milligrams of methylene blue, that's when you start getting into the realm of where you can be causing only stress on the system as opposed to having this energy and detoxification in combination. So there's been lots of crazy influencer articles about blue brains and about things like that, where you're these very, very high doses, 3 milligrams per kilogram IV. Yes, they will cause a brain to be blue, but these are in patients that are they're in ICUs, they're in cardiopulmonary arrest, they're in septic shock, and getting these very, very high doses to hopefully hopefully save these people's lives as kind of like a last ditch effort. So as with anything, as you know, is like the dose is most important. And so it's like a dose response curve, and how you should think about using methylene blue, and that's kind of how I think about it. Most of the time, I'm using it at very, very low doses for mitochondrial support: 4 milligrams, 8 milligrams, 16 milligrams, 25 milligrams. But it's not usually much higher than that, unless it's an infectious indication. And that's kind of how I think about it, right? So I know that there's been a lot of interest recently in the last 6 months or so, a lot of information that's difficult to wade through. But in general, just remember these lower doses are very safe, and they're very supportive. But as soon as you get to like higher doses, around a milligram per kilogram, or even a little bit less than that, if you've been sicker for longer, you might start seeing symptoms. And these symptoms could be like your Herx kind of symptoms, like
Yep.
your detoxification, a little bit more brain fog, headaches, muscle pain, joint pain, GI distress. Those are common, but starting at lower doses mitigates the potential of those. If you start off a very high dose very quickly, you're going to get much more of the potential of having those kinds of things.
No, thank you for that. And that was exactly, you touched on exactly what I was hoping you would, just to kind of provide some context about the benefits of low dose. And this is where low and slow really becomes the mantra. I do
Yeah.
want to touch on what you mentioned about fasting as a
Yeah.
hormetic stressor. I always tell people that so much of it is dependent on the individual. If you are someone that is not sleeping, you are under eating, you're over exercising, your hormones are in the tank, you're going through a divorce, you lost your dog. I mean, the constellation of stressors, like that is not the time to go overboard with intermittent fasting. Maybe it's 12 hours of digestive rest. And also the piece about carbohydrates. I think we have gotten so far off course about demonizing carbohydrates. I'm not talking about like processed carbs like
Right.
crackers and bread. I'm talking about, sweet potatoes and root vegetables and fruit, low
Right.
glycemic berries. I think we have demonized carbohydrates so much. If you are metabolically healthy, carbohydrates are absolutely part of your diet. And in fact, I would actually argue, and I've shared this very transparently, over the past 12 months in an effort to put muscle mass on, I've had to have a wider feeding window. And I actually do better with a higher protein and carbohydrate diet than I do with a lot of fatty meats. And
Yeah.
so
Yeah.
for
That's
me,
common too.
the
Yeah.
more carbohydrates, I probably don't have more than 75 or 100 grams a day. So let me be clear. It's not like I'm having 300 grams of carbohydrate. But I found for a lot of my patients, as soon as we start liberalizing their carbohydrate intake with good quality carbs, they sleep better,
Yep.
they feel less, agitated, they're able to work out harder, they just feel better. And so I think in many ways, if someone is not metabolically healthy, insulin resistant, then yes, carbohydrate restriction may be really helpful with
For
some
sure. Yeah.
therapeutic intermittent fasting. But certainly, the message is not don't eat any carbohydrates, because I think that can be problematic.
Yeah, 100%. And I'm on the same wavelength as you as well. Especially the more you're exercising, the more working out you're doing, the more the more carbohydrates you're likely going to need to see if you want to build muscle mass and strength. And but I was actually reading a study recently. A colleague of mine we're actually doing a talk coming up this weekend on parasympathetic activation for performance, and we're looking at carbohydrate intake and when it's most important. It's most important either intra workout or post workout. So you can use certain types of carbs intra workout. They're very easily going to be sucked up by your muscle tissue that needs them.
Yep.
You don't need insulin for that. And then post workout, it's really important for glycogen stores and then also for building muscle. And so if you're thinking about carbohydrate intake, you don't need to use them before workouts to have the benefit. It's just during and after where there's actually most of the studies. And so looking at that aspect of things has been interesting recently. On the performance side, of course, hyperbaric therapy is a fantastic tool for performance as well. But again, it comes in with this activation of parasympathetic mode where hyperbaric therapy, especially at milder pressures. So to talk about that just for a minute, if we have
Mm-hmm.
time, is like there's different levels of hyperbaric therapy. And I mentioned this a little bit earlier in the podcast for those that were listening, which was that there's different levels that we can give. I said like 15 feet of seawater, 33 feet, et cetera. So the milder pressures there are not going to be as stressful as the deeper pressures. The deeper you go, the more oxidative load that you're going to have somebody under. Now, in somebody that's super sick, for example, that has a lot of oxidative stress, a lot of inflammation, they might get symptomatic at a very mild pressure of hyperbaric therapy because they're not used to any extra energy production. But if you're relatively well optimized, you might feel fantastic at a milder pressure that's just giving you a little bit of extra oxygen without a whole lot of stress, but you might not feel as good when you go deeper, for example. And so it's important for me as I'm thinking about, so what I've done in some cases, for example, is that if somebody's very sympathetically dominant, and then we're still working on that autonomic nervous system reset, working on their diet, their lifestyle, looking at supplementation and things. What I sometimes will do is have them go into mild hyperbaric chambers. A mild chamber can give them a little bit of extra energy, it can give them a little bit extra focus, a little bit of extra oomph without causing too much stress on the system. Because what happens as you go deeper is that oxidative stress is also going to cause a sympathetic response because the body has to respond to that. And so you'll find though that over a hyperbaric protocol that sympathetic response is not as dramatic, but in the beginning it can be because it's going from some amount of oxygen, your baseline, to a lot of oxygen in circulation. But if you stay at a lot of oxygen for a period of time, which a protocol can be 20 sessions, 30 sessions, 40, 5 days a week. Sometimes we do hyperbaric therapy treatments daily, typically 5 days a week, for a cumulative exposure to that shift in DNA expression that we were talking about before. But as you're doing these hyperbaric protocols and like you find that sympathetic dominance actually drops and actually HRV gets better. So, but in the beginning, what you can do and like as you're starting to work with somebody as I do, I can say, look, let's do a mild pressure protocol, maybe go a couple times a week, and you'll feel better. You'll see your HRV is going to get better. Your recovery scores will get better, but not going too deep too quickly. Right. So using it more of like a wellness tool, like a little bit of extra oomph. I've seen that actually be very helpful from helping with that autonomic reset, as long as we don't go too deep initially. But if the deeper pressures are technically more therapeutic for systemic kinds of things, this is like we're talking about 2 atmospheres, or maybe a little bit less than that, like a 1.8. That's about 28 feet of seawater to about 33 feet of seawater ish. And that range is great for like systemic things. And we were talking about that longevity study in the beginning. That study was done at 2 atmospheres, for example. But the brain, also remember though, the brain is more sensitive to oxygen and pressure. So the neurocognitive indications tend to be more focused at the milder pressures, like your 1.3 to 1.8, and the more systemic related things are more focused between 1.8 to 2.4 ish as pressures. And then depending on the pressure, it will also depend on what kind of chamber design, whether it be a soft kind of chamber or be like a hard shell chamber, or like a single occupancy chamber, or a multiple, what's called a multiple occupancy or multi-level chamber where you can have multiple people in. And that's the type that I had with that experience initially when I was at Shock Trauma in Baltimore.
Yeah, it's so interesting. So inevitably the question will be, Dr. Scott, is, there's a company, I won't name names because I don't want to call them out, but like they'll have HBOT in their wellness center, but it's not the HBOT that I'm familiar with. Do those smaller, soft-sided, does that actually confer much in terms of benefit, or do you really need to be in these, what I refer to them, they look like an iron lung? I mean, they're just
Yeah.
these massive,
Yeah. The medical grade
yes,
machines. Yeah.
medical grade.
Yeah.
So helping like people understand if they're
Yeah.
using at one of those local wellness centers that are franchised across the United States,
Yep.
again,
Yep.
nameless.
There's multiple though. Yeah.
Is
Yeah.
there benefit to that? I'm assuming possibly, but I would imagine that for if you're really looking for therapeutic benefit, what the studies are designed on are the medical grade option.
So you can get some significant medical benefit from the soft chambers. I will say that, because if you have a neurocognitive condition, say concussions, stroke, mild cognitive impairment, even some brain fog as well, the mild chambers can be very beneficial. But the key is to understand what your goal is. Because if your goal is, oh, I just want to feel a little bit better this week, then sure, go in the chamber at a mild pressure. If you feel better in it, keep doing it. Fine. But if you have a goal, well, I have brain fog, or I have chronic fatigue, or I have mild cognitive impairment, or something more long-standing or more indolent, let's call it, then it's usually a good idea to understand why you're going into the chamber. Because if you go to one of these chain places, they're like, oh, go, we have a hyperbaric chamber. You want to use it? Sure, use the chamber. And like, well, what kind of protocol should I do? I don't know. Just go in when you feel like it. Yeah. And like that drives me effing nuts, because and that's one of the reasons I got so involved in education back. Now it's been a while. It's like I just would get all these calls from people trying to use hyperbaric therapy and getting like very poor direction or zero direction from the places that they were trying to go to, even in medical grade facilities. To be honest, that's gotten better. I like to think that I've helped in that capacity, because I know several facilities that show my videos to their patients when they're in the chambers, for example, and learning to learn about hyperbaric therapy. So like the first 20 minutes of my podcast with you are common, and you can find them in other podcasts, although I think I did a pretty good job compared to other times this time around,
No,
but
you did a great job. I was like, that's
I
the
mean,
best
I'm just, I
explanation
was
I've
sort of
ever
like
heard.
but there's ways to think about it, but in any respect, I think you can get benefit from the soft chambers. I have a soft chamber in my house. I use it periodically, and I use it regularly depending on the situation. I have 4 kids. If somebody gets knocked around, they come into the chamber with me, right? I have a daughter that plays soccer, for example, and she's not the biggest defender, but she's strong, but she still gets beat up sometimes. So she comes in the chamber with me. And so you can use I think there's a lot of benefit, though. When it comes to the medical grade chambers, using them, the deeper pressures are going to be more systemically beneficial. So outside of the brain and the spinal cord, for example. So what I often say, though, is that if you have a longevity indication here, you can benefit even from the mild chambers. You can benefit neurologically, and especially if you're combining it with other tools and technologies and practices. And again, my emphasis to all of your listeners is that I think it's a fantastic tool. I use it all the time. People call me from all over the world. I work with clinics all over the world that are integrating hyperbaric therapy within their environments, within their ecosystems, some medical, some non-medical. But it's not just about going into the chamber. And that's my ecosystem. That's what I've developed over the years. That's also what's gotten me into trouble in the hyperbaric community over the years, because it's not always about going into the chamber right away. So if you're already sick, if you have a long way to go, I can promise you that hyperbaric therapy is not the first thing you should be thinking about. A good example of this is that I've said this before on podcasts, but if you have chronic Lyme, and I do believe in chronic Lyme, I know some people don't, but I've seen people, for years and years. If you need to be about 60 to 70% better to see a significant improvement long term using hyperbaric therapy. If you're not already there, then it's not going to be a long term option for you that you're going to see like benefit. And in the beginning, when I first started working in hyperbaric medicine in 2012, I worked with a nurse named Gail who also had Lyme, and I saw her progress and I saw her lack thereof. Like I saw her get better, then she'd relapse and get worse and do more hyperbaric therapy. And then it became obvious to her over time that, she needed to be at a certain level for her to be able to really benefit. And so that was like my first experience with that kind of situation. But in the end, it's about creating an ecosystem in ourselves. Like the other word that, so we have a nonprofit on one of our companies called Health Optimization Medicine and Practice. And we train practitioners on how to optimize health, and we have a 7-module certification and all those things. But one of the main reframes we give for clinicians, you don't have to be a doctor to do this. You can just be somebody like that's seeing clients in any kind of capacity. It's called the holobiont. I don't know if you've heard this word before, but
No.
it's holo means whole, and biont is your ecosystem. And so that we all know that we live in a population of individuals that live like in a town, like in a city, in a state, all those kinds of things. But we are also our own ecosystem of human cells, of bacteria, fungus, and virus, of the food that we eat, of the environment that we're in, of the water that we're drinking. So this is called your holo organism, or your holobiont. And so we call ourselves holobiont hackers, not biohackers, or biont hackers for short. And so the idea with my clinical practice is to bring somebody into that ecosystem, this holo, and then optimize their holobiont, their holo organism itself. So this is that individualization you were talking about, Cynthia. It's not like you can just throw hormones on everybody through perimenopause. It's like you have to know what's going on, and then working on the data, and then cellular medicine, and top-down approach, bottom-up approach, and meeting somewhere in the middle. And where hyperbaric therapy comes in is somewhere in that middle, right? It's somewhere where like you can truly accelerate the progress of somebody if they have the right machinery to be able to do it. So like rebuild their brain. So now they can think better. They have less brain fog. You can use it for, their mild cognitive impairment, even some dementia and Alzheimer's and Parkinson's and chronic pain and chronic infections. Like the list goes on and on. Your autistic spectrum patient, your kids as well, but not without the other stuff. If it's an acute issue, sure, but without the other stuff, long term, I just haven't seen the benefit without doing that holo organism approach.
Well, and I think that's such an important distinction so that people understand it's one of many strategies used at the right time when you've made enough progress. And certainly, if someone has a chronic issue, it might be farther down the line. If it's something acute, like a traumatic brain injury, someone's had a recent stroke, things like that, where it might be more beneficial to use it up front. To kind of round out the conversation today, I know that there are 14 approved indications for HBOT.
Mhm.
We've touched on many of these. Do you feel that there's still pushback from a lot of insurers? I'm not even sure if you work with insurance, but for someone that's listening, we do have a lot of clinicians that listen to the
Sure.
podcast
Yeah.
that are trying to help their patients. Do you typically find that most insurers are willing to consider this option, or is it really the scant few insurers? Because I feel like even though I have good insurance, I mean, sometimes we get pushback. They want you to try 15 other things, make sure they've all failed. Then they're willing to entertain the possibility that one of these considered to be alternative therapy options might be viable.
So there's 14 indications that are covered by insurance in the United States. There's very little way to back into these diagnoses because they're very specific. So the first one is diabetic foot ulcers. So if you have somebody that has it's a Wagner grade 4 ulcer, so basically just gangrene and close to amputation, hyperbaric therapy is approved as a adjunctive treatment to help try to reverse and prevent an amputation. And I had stories when I was first starting out and doing a little bit of both, doing both the conventional hyperbaric work, which I don't do anymore, along with the more integrative and outside the insurance system. Remember I had one lady, she was very sweet, like old Filipino lady, and she'd already lost two of her toes. She came in, we saved her third toe. And she asked me afterwards, she's like, Dr. Scott, why didn't they send me for the first two toes? And
Oh.
so it was, heartbreaking on some level, but doctors aren't actually, they're underutilizing hyperbaric therapy.
Mhm.
That's what it comes down to. It can be sometimes difficult to get it covered, like you said, but if with the right criteria, it should be. The other one that's big is radiation injury from cancer treatment. So radiation exposure, breast, bowel, prostate, brain, all these places that we get radiation for all these types of cancers, there can be radiation injury. And radiation injury can be significant. What
Mhm.
hyperbaric therapy does, it can regenerate the tissue in the radiated bed. So new blood vessels, new stem cells, new connective tissue. And so we see really great saves, and it's the best treatment out there for a radiation injury that's symptomatic after radiation exposure. And so vastly underutilized for that particular indication. Radiation oncologists think that they're so good at what they do, they don't think about these mild things sometimes, or maybe more severe. Uh, and hyperbaric therapy becomes a last ditch effort, sadly. But it does often work. I work with people that have a common one is a radiation cystitis. So this is when
Mhm.
you've gotten radiation to your bladder or around your bladder, maybe for a prostate kind of thing if you're a male, and you get radiation cystitis. So your whole bladder gets friable and inflamed and bleeds, and so you have chronic, hematuria,
Mhm.
chronic
Yep.
bleeding in your urine. And they do what they go in is like they'll do all these like cauterizations, and like they'll go in with like and try to burn it all. It doesn't often work and it recurs, but hyperbaric therapy can reverse all that, right? So radiation injury is a big one. Diabetic foot ulcers, I mentioned. We're called flaps and grafts in plastic surgery. So if you get a plastic surgeon, you get a graft at a certain location, doesn't look like it's going to take. Hyperbaric therapy can be really beneficial there. Sudden hearing loss, sudden sensory neural hearing loss. So this is a hearing loss that's neurologic in nature. You wake up one morning, you can't hear, or half of your hearing's gone. It's very devastating in some people. Hyperbaric therapy can reverse that. And chronic bone infections, osteomyelitis is another one. The other indications are all really in acute care settings. So carbon monoxide poisoning, burns, diving injury. So the reason hyperbaric therapy was developed was for decompression illness and diving. That's a whole nother history lesson for another time, but people can look that up. Scorpion bites, actually. So scorpion
Oh.
bites. Is it scorpions or is it no? It's a certain type of spider bite that can cause gangrenous and
Yep.
and like loss of limbs that hyperbaric therapy is approved for. What else? Those are the major ones overall. And acute trauma, like acute compartment syndrome, where one of the limbs isn't doing very well, or partial amputations and things like that. So I saw it for some of those when I was at shock trauma. But in essence, as I mentioned, before mentioning them specifically, is that you can't really back into those diagnoses. It's like really like it is what it is. And but if you can get it covered, like obviously that's great for your insurance. But if you have an off-label indication, when these are ones that are not covered by insurance, these are going to be out of pocket for you, right? And that's why I'm so emphatic about making sure that it's the right time for you to use this technology rather than spending your money up front where it might have been better to use it in 3 or 6 months. And that's where I when I consult with people, that's often what the conversation I'm having is like, is it right now that hyperbaric therapy is helpful, or should you wait 3 or 6 months, get optimized, go see a couple things, start some methylene blue or some GABA or whatever. But usually it's more holistic than that. But sometimes it's just like giving them some things that can help support them while they're on the path of trying to figure out more of a holistic plan as well.
Well, I always so love our conversations. Please let listeners know how to connect with you outside of the podcast, how to tune into your podcast, learn more
Sure.
about your supplements, or even your certification program.
Yeah, so lots of things. So the easiest sort of central hub for me is my name, drscottsherr.com, DRSCOTTSHERR. It's nothing fancy, but it gives you a sense of all the things that I do. I have a hyperbaric consulting business where I consult with people all over the world on how to use hyperbaric therapy effectively. My secret's out that a lot of that has nothing to do with hyperbaric therapy. It's going to be about other things that might be able to help you. And so that's at integrativehbot.com, but you can just go to my initial website. And I also have my own, what's called health optimization medicine practice, where I work with people on the long term to optimize that holoorganism that we were talking about. So again, you just go to my general website, you can find information on that part of my practice. There's the nonprofit itself that trains practitioners. That's at Health Optimization. It's called Health Optimization Medicine in Practice. The website is homehope.org. And what else? So from my personal side of things, you can find me on Instagram at Dr. Scott Sherr, DrScottSherr. We also have a company called Troscriptions, which makes products and makes some methylene brew products. We've discussed also makes products in the GABAergic space. I used them a lot before Troscriptions was around, and now I use a lot because we've developed them as well. And so we have some great things called Just Blue, for example, for methylene blue. We have Trocom for anxiety and stress relief, and Troz for sleep, and some other things that can be really, really helpful. So you can check that out at Troscriptions, also at troscriptions.com. And what else am I forgetting? Oh, on the hyperbaric side, of course, I have a company called One Base Health, and One Base Health is an ecosystem that we're developing to help people integrate their technologies together in kind of a home suite of things. But a lot of that's based on what I've been describing here today, is that when you're creating protocols, it's what tools, what technologies, what supplementation. So the idea is to create that within a home ecosystem for everybody. And that's at onebasehealth.com. And there's also chambers and other types of technologies available for people as well.
Thank you so much.
Hey, if you like this video, you guys are going to love this video, and I'll see you there.
We are trained in our education to really memorize certain aspects of science that get really applicable in treatment of disease, but not so much for prevention. And yet, as we go on, we start to open our eyes to the fact that many of these diseases could be prevented in the first place.